So our group is going to be looking at the postmenopausal nutrition and disease prevention program. So the scenario that we have received is that a physician wants to create a nutritional program for the patients in his practice who are postmenopausal or who are at the target age of approximately 50 to 65 years old. The physician is leaving you or leaving us, the consulting RDs, responsible for identifying the nutritional topics that would be best to meet the needs of these populations. The physician states that many of his patients have been asking about soy, calcium, and heart healthy eating and weight management as well. The target group consists of middle income and upper middle income females, predominantly Caucasians. The physician's office has a conference room that could be utilized for nutritional lectures. So this is how we build our presentation. There are some learning outcomes and the foundation. So identifying the national goals for health promotion and disease prevention for adults, recognizing the and leading nutritional related diseases and causes of death of women, select appropriate nutritional strategies for disease prevention among postmenopausal women, and here are some of our resources.
The Women's Health Initiative is a study that was started in the early 90s, and its main focus is on improving the lifestyle and health of older women. Postmenopausal women have higher chances of getting cancer and heart disease, so researchers here look into how can they prevent that. Women's Health Initiative consists of two significant parts, a clinical trial and an observational study. In the clinical trials, there are three prevention strategies. So the first is being hormone therapy trials, the second, dietary modification, and the last, calcium and vitamin D trials. For the purpose of this case study, I will focus mostly on dietary modification and calcium and vitamin D. However, I will briefly touch on the hormone therapy trial. So, for the hormone therapy trials, it was designed to test the effects of postmenopausal hormone therapy on women's risk for coronary heart disease and on hip and other fractures and breast cancer. The participants in the trial received two pills, one being the placebo pills and the other being estrogen plus progestin. I also want to mention that the trials took place between 1993 to 1998, so it was about a mean of 5.2 years. The participants were women aged 50 to 79 years old with an intact uterus. So after the follow-up, conclusions suggest that the risk-benefit profile found in this trial is not consistent with the requirements for a valuable intervention for prevention of chronic diseases, and the results indicate that this regimen should not be initiated or continue for primary prevention of coronary heart disease. So in other words, the combination pills, estrogen plus the progestin, did not have any effect on, or I should say, prevention for coronary heart disease. Moving on to more relevant information for the purpose of this program, nutrition findings. For the dietary modification trial, researchers found that a low-fat dietary pattern intervention did not reduce the risk of diseases such as coronary heart disease, stroke, cardiovascular disease, breast and colorectal cancer in postmenopausal women. However, conclusions suggest more focused diet and lifestyle interventions may be needed to improve risk factors and reduce cardiovascular risk. For the calcium and vitamin D trial, calcium with vitamin D supplements did not affect the incidence of colorectal cancer in postmenopausal women. However, calcium with vitamin D supplements did have a small but significant effect on hip bone density, but no significant effect on reducing the hip fracture. Also, it increased the risk of kidney stones. So all in all, what we can take away from these two trials is that nutrition does play a part in preventing diseases in older women and keeping a healthy lifestyle. As I mentioned previously, there needs to be a more focused diet and lifestyle intervention so we can see, or researchers can see, the improvement of risk factors and reduces in diseases. Now, looking at our target group of postmenopausal women from the ages of 50 to 65, nutrition issues that greatly affect them are cardiovascular diseases, strokes, and cancer. So what can we do to help these women live a healthier lifestyle and prevent these diseases? We can focus more on diet and even weight management. Like in a dietary modification trial, researchers suggested that there should be a more focused diet. So going off from the trials, we would have to modify and add different diets to see what would really show a significant effect in helping these women maintain a healthy diet or healthy lifestyle. Resources we would use to determine the legitimacy of the nutrition topics relative to health issues and disease prevention are from well-established organizations. These organizations are Mayo Clinic, National Institutes of Health, which is one of the sponsors of Women's Health Initiatives, Academy of Nutrition and Dietetics of the National Cancer Institute, and the U.S. Department of Agriculture. These resources have extensive details on dieting, weight management, physical health, anything that has to do with living a healthy lifestyle. Also, great information and knowledge on diseases, disease prevention, and so forth. Here is an article regarding the Women's Health Initiative. In the article, they discuss the relationship between diseases and disease prevention with nutrition and dietary composition. Researchers found that there is an association with nutrition and diets with preventing chronic diseases amongst postmenopausal women. However, there's much more research needed for the association between diseases and disease prevention for nutrition and dietary intervention.
Draw and implement conclusions. So we are tasked with creating a program for postmenopausal adults to be presented. Before building a program for postmenopausal adults, it's really important to know about the population and how to approach this program, thinking about and prioritizing what topics should be covered, what the structure of the program is going to actually look like, and then, of course, what activities present to the population. Just things to know about this population. This postmenopausal group are known as baby boomers, and it's really important to know the priorities of baby boomers before implementing the program. So the first thing to know is that they are generally concerned about what is healthful and convenient for them. So having buy-in around things that are healthful yet convenient is really important. They tend to make decisions based on their own personal beliefs and values. So having a program that's learner involved, hands-on activities where they feel as though they're invested in the program. Their time is precious, so they have a lot going on, raising families, helping elderly, jobs, just a busy schedule. So this time should be used valuably. So it should be practical, convenient, understandable for this community. They value quality and investment, so they're not going to spend money on things that they don't feel are useful. So making really thoughtful decisions about why they purchase certain things. And they need a dynamic and upbeat program. They tend to be tough critics, and they want something that feels helpful to them. And they also make decisions based on nostalgia. So incorporating emotion into things like meal planning or movement is a really important thing, connecting it to them as a community or them as an individual. So based on what we know about this population's health needs and what they need in terms of having a long life, and what we know about them and their interests, there are certain topics that should be covered in this program. So the first is really the importance of having a nutrient-rich diet and a heart-healthy diet. So not having things like empty calories and really making sure they're purposeful with the foods that they eat. There should be an increase in fruits, vegetables, and whole grains at this age, and a decrease in things like sodium and sugar and saturated fats. So finding foods that taste good, and they like and are nostalgic, but also have a lot of nutrients in them would be the key. The importance of vitamins and minerals and why they need a lot of vitamins and minerals at this age. And of course, movement and exercise and how that builds healthy hearts and healthy bones, and this kind of use it or lose it attitude around exercise and making sure they have a lot of movement. It's also important to have access and sharing with this group the access to different food programs that they have or different resources that they have. And then the importance of having regular doctor screenings and doctor visits at this age to make sure they are up to date with all their immunizations, and having a doctor take a look at things like their blood pressure and their sugar levels, but also if they were to have things like cancer or heart disease, to catch it early to prevent that from getting to later stages that are going to harm them. So what the structure of the program is, it would be 5 90-minute sessions with the participants. And this table explains kind of what the session is and why it's important. So the first session, I think it's really important to have buy-in from this population. Again, they're tough critics. They have high expectations, and they want to make sure that this program is for them. So I think conducting things like interviews or surveys, having icebreakers or getting to know you activities, and being very clear of the purpose of the program. So kind of setting up the stage. I think if there's time in session 1, you could get into the importance of nutrients, but I think spending some time getting to know the participants, having them fill out surveys, and building trust is really, really important with this population. The session 2 should really be the nutrient-rich diet education. So talking about why they should have a nutrient-rich diet, the importance of vitamins and minerals and all of these nutrients, and kind of understanding the science behind it. Session 3 should really be hands-on. So based on the information from session 2 and some of the responses from the first session around getting to know them and the surveys, it should be focused on planning meals together and then possibly cooking a meal as a group, an example of a nutrient-rich meal that tastes good and brings back good memories, and actually having a hands-on activity. Session 4 would be around exercise and movement, why exercise is important, the different things that people do for exercise, and again, having some time to actually do some movement in that session. And then the last session is really around access and helping them find access to food, different programs that are available to them if they need assistance for food, and some annual doctor's visits and kind of planning them. The last 3 sessions should really be hands-on, practical knowledge, and should help them have individualized plans, because that's what's going to be the most helpful for them and for their buy-in. Some of the activities, so the first one, again, you could do icebreakers, individual share-outs, some pair shares, making sure you're going over the goals and priorities of the program, why it's important, and having time for them to fill out a survey that will inform some of the individualized activities in future sessions. So making sure having ample time to fill that out, so that will inform your sessions in the future. The next one is around the nutrient-rich diet. So session 2 should really be around the My Plate, particularly around older populations, maybe some videos or some activities around nutrient-rich diets, maybe some articles that show the importance of nutrients instead of just saying it's important, having some data or some proof around this that's catered to this population, and making sure you're talking about calorie balance. So having nutrient-rich calories, but also make the importance of having calorie in be matched with the calorie out with exercise. The third session is around is the practical session. So how to plan a nutrient-rich meal, maybe looking at some recipes or some recipe books online, maybe having folks share out some of their favorite recipes that they've done, and kind of catering them to be a little healthier, and then actually cooking a meal together, or if that's not possible, going to a grocery store together and kind of planning out what that would look like for the meal. Session 4 would be around movement. So again, video or activity around the importance of exercise. And I think it would be great to have a share out of their favorite movements, what they like to do to move their body, what makes their body feel good when they're moving. And then doing some kind of movement together as a class, maybe doing some yoga or some going for a walk together, or maybe a little bit of a higher intensity workout if the population is able to do that. But again, that's based on that survey from the beginning of the first session. And then the last session would be access to food and food programs. So if someone or any of the population needs access to resources, so going over like the SNAP program or the program that is partnered with farmers markets, and how that application process works if they need. Also talking about the importance of screenings and doctor's visits and preventative care. And if they don't go to a doctor regularly or don't know where to go, providing some resources of how to book a doctor's appointment, or maybe booking the doctor's appointments for them, or going over a list of doctors that they should be going on an annual basis or a biannual basis for screenings and things like that. So the whole purpose of the program is really to be catered to this population in the most individualized way as possible, but also catering to the needs of this general population and what we know this population needs.
So we are here at step 4, where we are going to look at variables used to monitor the impact of this program. There are 2 groups of these variables, short-term as well as medium and long-term. So for short-term, we could look at things such as attendance, returning participants, who are those people who come back for the second, third, and fourth day as well. We could survey and ask the participants to see how they are feeling and if they are feeling more in control of their health after the workshops. We could also look at improved nutritional knowledge of foods, how they are feeling comfortable and knowledgeable when they are shopping, as well as things that they are consuming. As well as we could ask them about their mental health and how their overall feeling is, and what they feel like, things changed after changing their diet and being more conscious and more knowledgeable about their nutritional intake. There are also some long-term goals of this program and variables that we would be able to measure and monitor. One of these things could be weight loss and optimal and healthy body weight. We could be working together with the physician to set this goal. Healthy eating habits, which is also a long-term goal as well as a short-term goal, but it would be more beneficial for the patients and the participants to have this as a habit for the long term. And more optimal test results. Again, here we would be working together with the physicians to see test results such as better cholesterol and more blood tests and such.